hope I'm audible and visible. And welcome in the next session of Dermatology with me, your NEET PG educator, Dr. Chesta Agarwal. So let's start with today's class. I request all of you to kindly give me a thumbs up if my audio video is fine. So I hope my audio video is fine. Yes, very nice. So before start the session, let me go through the regulars. We have scheduled All India NEET PG 2022 mock test on April 17th, 9 a.m. As I always request everyone to please use my code CHESTA10 and get yourself enrolled on this free live test. I would be requesting all of you to participate in large number because it will give you an all India rank prediction before the exam. We have recently launched a mode or a different type of subscription which is called as Unacademy Lite. This is the most favorite right now for all the students. We're having a lot of subscriptions with Unacademy Lite. Now, what is Unacademy Lite? It gives you an access to overall 450 plus practice tests. So it's a very high time when you practice whatever you have read. For having a good result in your final exam, you should prepare yourself by doing a lot of MCQs. And the only target of this subscription is to give you a lot of MCQs. We have subject-wise tests, system-wise tests, full-length mock tests, PYQs, test series. We have 90 plus grand test, which is now available on Android and web. You might need a code for taking this subscription, and the code is CHESTA10. I welcome all of you. Now we have also launched an MBBS Prof 1 batch starting on April 20th. You will require a code for that. The code is my name, Chesta10. 3 month, 6 month, 12 month pre-launch prices has been discussed. So it is way too cheaper than what we usually give. So requesting all of you to please kindly get yourself enrolled. We have also launched a daily practice paper series, which is a feature only for the paid students or the plus students. After the end of the class, we'll get the daily practice questions. We have also have two type of subscription plus which give you an access to Unacademy and Iconic give you an access to both Unacademy and Prep Ladder. I congratulate to all the students who are giving the recent exam and those who have cleared their exam with a good rank. Now, special class features, these are the live free sessions taken up by all the educators. We have FMG test or FMG series starting on 13th. We have a NEET PG series starting on 13th. And we have a doubt clarification batch which have started on 6th. I request all of you to kindly get yourself enrolled. You might need a code. Please remember my code CHESTA10 to get yourself enrolled. Please remember this code. Plus, Iconic and Light subscription prices are here. Now, please give me a thumbs up if everyone is ready for the first question of the today's session. We have a lot of MCQs with us. So, starting with the first question, I hope everyone is ready. This is my first question. A 29-year-old female, it's a long, lengthy question, so I would be requesting all of you to please read it carefully, look at the image, and try to solve the question. A 29-year-old female with history of ulceration in the right lower leg since 6 months was referred from the surgery department. The ulcer was refractory to the treatment in spite of antibiotics and antiseptic. The detailed history was noted that the patient was diagnosed to have ulcerative colitis for 9 years and she had developed an ulcer over the right lower leg for 6 months. The ulcer have started spontaneously as a small erosion and gradually increased in size. Which of the following is the correct answer here? Anyone can tell me the answer? Very nice, Dr. Shagufta, Varsha, Celestino, Pradeep, Vishnu. Very well done. The correct answer of this question is option number 2. Let me tell you how the answer is option number 2. Now, the points which you all need to know is first, there is presence of an ulcer, which is there since 6 months. So, a history of ulcer which is present for a very long duration, which is refractory to antibiotics and antiseptic. It means it is not because of an infection. If it is because of infection, it should get improved by antibiotic and antiseptic, but that is not the case. Next thing is there is a history of ulcerative colitis in the patient. All these three things indicate that we are dealing with a condition which is not infective, but it is something called as neutrophilic dermatosis. And one of the very important example is pyoderma gangrenosum. Now, here in this condition, patient has accumulation of neutrophils in the skin, in epidermis, dermis, and because of which they start developing rapidly progressing ulcers. These rapidly progressing ulcers will then manifest like this, non-responsive to antibiotics and antiseptic conditions. Can anybody tell me how to treat them? What is the treatment of choice? Pradeep, Shagufta, Varsha. For treating them, we need steroids, oral steroids, or we need to give some drugs which works on neutrophil like Depson. So very important, pyoderma gangrenosum. We see individuals having an association with ulcerative colitis. The other causes for development of pyoderma gangrenosum, they are drugs like GCSF, GMCSF, infection, and inflammatory bowel disease. You can even get it in the patient with the blood leukemias like lymphomas or leukemias. Next question is on your computer screen. Let me just move this image on the left so that you all can understand this. This we have done in our special class. I hope you all remember it. Pradeep, Shagufta, Varsha, anyone can tell me the answer? Again, a long, lengthy question. A 5-year-old boy with recurrent multiple itchy blisters all over the body since 2 months. The lesion burst open with 2 to 3 days, forming erosions with serous discharge. Which of the following is the correct answer here? Very nice. This is a patient with chronic bullous dermatosis of childhood, CBDC. It is also known as what? I think this everybody knows. It is known as linear IgA disease. This is known as linear IgA disease. Now, what are the features of this disease? First of all, as the image indicates, what is the important feature about the image? If you look at this image, if I zoom this image, you can see that there's a large bulla and multiple vesicles surrounding it. Yes or no? How many of you agrees with me? There's a large bulla and multiple small vesicles surrounding it. This is a very important feature of linear IgA disease. A large bulla, multiple small vesicles surrounding it, and this is known as string of pearl or cluster of jewel appearance. String of pearl or cluster of jewel appearance. It is very common in children of about 5 years to 10 years of age. Here you develop IgA type of antibodies against one of the component of basement membrane, which is BP antigen 2 or BP180. BP antigen 2 or BP180. So please remember, whatever is given in the question, just look at the image. Image is something which is very, very characteristic of linear IgA disease. I hope this is clear. Anyone with any confusion, please do let me know if you have any confusions. Now moving to the next question. A 67-year-old woman with a 15-year history of pain in multiple joints, symmetry, migratory affection. He did not report lesions of any kind on the skin, but on the nails there were leukonychia, crumpling of the nail, hyperkeratosis. Upon questioning the family, patient describes a history of desquamatic lesion in the father, and recently the patient have developed some scalp lesion in the daughter. So what is the diagnosis? Vishnu, Dr. Priya, Shagufta, Vidhi. Anybody can tell me the answer. Very important, very simple question actually. Yes, this is a patient with psoriasis. Very nice, amazing. Now it is actually a patient with psoriatic arthritis. I hope you have heard about this entity. Now for classifying the patient into psoriatic arthritis, we have two type of criteria. One is known as Casper's criteria and another is known as Mole and Wright criteria. One is Casper's criteria and another is Mole and Wright criteria. Now, what are the points included in Mole and Wright? We have 3 points, 1, 2, 3. Presence of skin lesion, which is corresponding to the psoriasis. Psoriasis means erythematous scaly lesions on the extensor or scalp or palm and sole. Presence of negative rheumatoid factor, the arthritis with negative rheumatoid factor. These are the three features which you should have for keeping a patient into a diagnosis of mole and Wright. In Casper's criteria, we have the similar 3 points, but there are few more points. Number 4 is nail changes. Number 5 is positive family history. I hope this is clear to all of you. So for diagnosing into mole and right, we should have three criterias, while for Caspas, we should have five criterias. So it's a very classical patient. You can see there is involvement of joint, involvement of nail, positive family history, all gives you an idea of psoriasis. Can you tell me what is the treatment of choice for psoriasis? What is the treatment of choice for psoriasis? How do you treat? Very nice. You will treat psoriasis by giving methotrexate in these patients. You have to treat these individuals by giving methotrexate to them. Next question in your computer. On your computer screen, a very interesting question. Again, a little longer question. I would be requesting all of you to give me a quick thumbs up. Combat healer, Shagufta, Nana, Amalgamate, Arjun, Combat, Vishnu. I would be requesting all of you to please answer the next question which is there on your screen. Very nice, very interesting. Read it carefully. Now, here in this question, if you read it carefully, there is a 68-year-old male who presented to emergency room with bullous lesions. Now, let me give you some hint. I know it's a little difficult question. So, this patient has presence of bullous lesions and erosions. How many of you agrees with me on this? Yes. So, we have bullous erosions in both skin as well as oral mucosa. Patient also have a history of malignancy. And when we did the biopsy, we could see that there is suprabasal acantholysis. Now, one thing which you all should know, whenever you read about the vesicular bullous disorder, oral lesions with suprabasal cleft, this is a very classical feature of pemphigus vulgaris. Oral lesion with suprabasal cleft, it's a very classical feature of pemphigus vulgaris. But what does this associated malignancy indicate? It indicates that you are dealing with something called as paraneoplastic pemphigus. Paraneoplastic pemphigus. It's a variety where you have an underlying malignancy, and because of some factors or cross reaction, you develop paraneoplastic pemphigus, not pemphigoid. Paraneoplastic pemphigus. Clear? Now, in this patient, you see IgG type of antibodies against desmoglein, both 3 and 1. You can even see antibodies against the plaquin group, which is the intracellular part of desmosome. Even against BP180, you see the antibodies. They present with very recalcitrant lesions, for example, which are very difficult to treat inside the oral cavity or inside the genitals. So, paraneoplastic pemphigus is a very interesting example of the last question. Let's move to the next. A 62-year-old woman who presented to emergency department with diffuse erythematous rash over her body following the second dose of a drug. What is the correct answer for this particular patient? What is the correct answer here? Anyone can tell me the correct answer? Very nice, all of you. Good. Okay. Now, here in this question, one thing which you can see is there is a drug reaction history. Clear? There's a drug reaction history, and in this drug reaction, following which patient develops exfoliative skin lesions. Clear or not? Is my audio video clear to all of you? Can I get a quick thumbs up if you can see my audio video? Yes. The correct answer is toxic epidermal necrolysis. Now, drug reaction or exfoliative drug reaction is of two types. One is Steven-Johnson syndrome and another is toxic epidermal necrolysis. In both of them, you will have presence of skin exfoliation. How to differentiate? Please remember, in both of them, mucosa involvement is present, but the body surface area involvement is different. It is less than 10% in SJS and it is more than equals to 30% in 10. While 10 to 30% is Steven Johnson syndrome and SJS overlap. SJS 10 overlap. Moving to the next question. Moving to the next question. A 1 month old infant with uneventful birth was noticed to have a scalp swelling 5 days back. The baby was exclusively breastfed and gained adequate weight, was treated with oral antibiotic. On examination, we could see a localized patch. What is the correct answer? Very nice. The correct answer of this question is Kirion. Now, recently in our exam, we have got the same question. From this particular chapter, please remember, in infectious disorder, fungus becomes very important. Fungal infection is very important, from which you get a lot of questions. In fungus also, dermatophyte, that is tinea infection, is very important. These are few things which you have to keep in your mind whenever you prepare for your NEET PG entrance or FMG or INI-CT. In tinea capitis, we have an inflammatory type of tinea where you have a lot of inflammation. You have presence of scarring alopecia, and there is a non-inflammatory type of tinea capitis where there is less inflammation and it is a reversible non-scarring type of hair loss. Example of inflammatory tinea is Kirion, which presents with bogey swelling, and Favus, which presents with yellow color cup-shaped lesions. Well, example of non-inflammatory is what? Anyone? Black dot tinea and a gray patch tinea. Black dot tinea and a gray patch tinea. Very nice. I think everybody remember this question. Now, this is a very important question. The next question. A 19-year-old housewife who presented within hours after her first delivery with fluid-filled lesion over the abdomen and the limb. On examination, we had multiple tense vesicle bullae. What is the correct answer here? Very nice, Dr. Shagufta, Dr. Priya, Sama, Soumya, NKN. Now, this is a little different type of question. The answer to this question is option number two. So, I think there are many students who have marked it right. Now, what is pemphigoid gestationalis? It is nothing but bullous pemphigoid of pregnancy. When a pregnant patient develops bullous pemphigoid, it is known as pemphigoid gestationalis. Now, here few things which you need to know, that the risk of bullous pemphigoid in pregnancy is maximum in second or third trimester or within or near the delivery, within few weeks of delivery, both before and after. Now, why there is a relation with that of the time of pregnancy? The reason is one of the very important precipitating factor for development of pemphigoid gestationalis is the level of estrogen and progesterone. Now, here what happens, patient develops a very classical tense bulla with erythematous base. The site is surrounding the umbilicus. You see these lesions surrounding the umbilicus, which is very, very important. Sometimes the autoantibodies, which is IgG type, against BP 180 or BP antigen 2, it enters the fetal circulation and can cause infection in the fetus also, or can cause vesicular bullous lesions even in fetus also. So very important, pemphigoid gestationalis. Once the patient delivers, the lesions improve spontaneously. We may not need to give a very prolonged immunosuppressive therapy here in this patient, because the main precipitating factor is the fetal component. Once the baby is out, the lesion will improve automatically. Clear? Can I get a quick thumbs up from all of you? Yes. Let's move to the next question, which is on your screen right now. A 65-year-old man with an asymptomatic erythematous swelling plaque on his right ear, which has been gradually progressing for 15 years, On examination, red-brown infiltrated plaque was palpated on the earlobe just above. The dorsum of the ear was particularly livid in the color. The PPT shows that the lesion has induration of 20 What can be the diagnosis? Amazing. Dr. Priya, Soumya, you are right. The correct answer of this question is this is a patient with lupus vulgaris, which is the most common type of cutaneous TB. Even if you are not aware about the image or the question, the last line will help you a lot. So I always ask my students to have a retrograde approach to the question. What do you mean by retrograde approach? This is very important. Read the last line first and then read the whole question. I'm not saying that only read the last line and go to the exam. No, read the last line first, then go to the whole question, read it, and then solve it. It's a very easy approach for solving the questions, which will help you get a good score in your exam. The last question, please answer this question. I would be explaining this question in my live class, which is starting at 3 p.m. on Unacademy Learning app. So I would request all of you to please download the Unacademy Learning app right now, because at 3 p.m. I will be starting with my free class. You just need to download this app and they might ask you for a code, which is Chesta 10, to unlock my free special class. So requesting all of you to please go ahead and watch me live after 2 minutes on Unacademy Learning app. I will be giving you the answer of this question on the app itself. So thank you for watching. I'll meet you again at 2:30 p.m. on the YouTube channel, and let's see you after 3 minutes on the special class on Unacademy Learning app. Till then, bye bye, good day, take care. Please subscribe this channel and download the Unacademy Learning app using my code Chesta.